camera going? Now we have, these are our tools, so let's take off jewelry. So we'll do a thoracolumbar release, and then we'll do a what's next on there? Quadratus lumborum, and then we'll do sacrospinalis. Okay, so this is an osteopathic myofascial slide over. I changed this in the book because it was taught as the 3 T's, but I have always had a hard time seeing the first T as tension. So you put your hands at the TL junction, thumbs parallel, and you're releasing this junctional area. Remember we have junctional areas? OA, CT, TL, lumbosacral. There's areas of mechanical stress and chaos. Anytime we have junctions, one set of mechanics merging into another, sometimes we have stress and things become injured, tight. Actually, the underlying area may become a little loose from the transition, but the tissues will protect and guard. They might become a little stiff. So, paraspinally, the 3 T's are tension, traction, twist. I did this already, right? We'll do it again. We did it in the thoracic. So tension, traction, twist, but I changed the tension to compression because you're pushing down towards the table. And then the traction is you're separating the tissues between your thumbs. Then the twist is I'm taking my left hand clockwise, my right hand counterclockwise, and I'm really stretching the TL tissues. I'm really loading them up. So this is really, in my thinking, is a combination direct, indirect. Starting off direct, I'm winding it up, making it as tight as I can, and then I'm going to let it go and release it. So you can make it even tighter. I can have him turn his head to the right and see what that does. Turn your head left. And when he turns left, it gets a little loose. Turn right, it gets a little tight. So I'm going to go with the right. We're going to have him breathe in. Breathe in. That's going to give me, breathe in all the way. Good, good. Hold it, hold it, hold it. Good. Now I'm really stretching. And now breathe out. And now let it go. And now I just follow the unwind. Just let it go wherever it wants. Just let it free up. Now you just kind of pick up the sense of where the tissues want to go after you tighten them up maximally. Soften them up. Okay? So we start out loading them, tightening them as much as possible, and then we allow them to release. QL release is on, let's do the right side, on your side towards me. Similar to the mode we just did, except we're not thinking so much facets, we're thinking about the quadratus lumborum. So we're going to rotate him a little bit, right? Position him here, stabilize the lower quarter. I'm going to get my fingers on the QL. QL run from the iliac crest to the 12th rib. I'm going to separate. So with the wide pelvis, you want to towel roll under here. I'm going to pick up the tissues and then stretch them. Side bending left, rotation right. Really stretching the quadratus lumborum. So come in here, fingers just paraspinally. And then I go long lever through the shoulder and hip girdle. And then I do short lever right on the QL, side bending. So it'll be side bending left and then rotation right. Now I can add a little hold relax. Don't let me move your shoulder girdle and your pelvis apart. Move them together. Side bend to the top side. Good. 1, 2, 3, 4, 5, 6. Relax. Good. And stretch the QL. I'm stretching a lot of things. I'm stretching the erector spinae as well. Really getting a nice fascial stretch in the whole paraspinal area. So you can start off with the myofascial, and then you can incorporate the hold relax or the post-isometric relaxation. Again, bring your shoulder and hip together. 1, 2, 3, 4, 5, 6. You should feel it tense up. Breathe in. As you breathe out, relax and let it go and stretch. Just make sure there's no reticular symptom. That's a little stress on the disc. All right, lumbosacral. On your stomach. Lumbosacral release, also called lumbosacral decompression. Straighten out. On by your side. Or you can do it that way. So I'm going to find the PSIS, and then just put the heel of my hand on the sacrum inside the PSIS. I'm going to be on the sacral base. My fingers are going to be on L5. And I'm going to separate the sacrum away from L5. So people who have a little hyperextension going on at the lumbosacral junction, this feels great. It just decompresses that area. So I can start with straight caudal decompression. Disengage. And I want to do a little myofascial. So I'm going to rotate my hand one way, rotate it the other, see where I find tightness, where I find bind. Not ease, I'm going to go direct. So I go to the right, not much restriction there. I go to the left and I really feel it tighten up. Good. I can use breathing, breathe in, bring it tighter, tighter, tighter. Good. And now breathe out and relax. And now stretch it. Just let it go. Just decompress, unwind, free it up. Okay? So at the lumbosacral junction, hold one, move one, stretching the sacral side, straight caudal, adding a little bit of a twist to it depending on where he's tighter. Sacrospinalis on your back, basically the lower aspect of the erector spinae. Bring them up this way. This you would not do on someone who's ever had a history of a disc problem. So they have pain when they sit in the car, they get up, they can't straighten up quite easily. You don't want to do this, you could really hurt them. Put your hand under the sacrum. You're going to go on the knees like this. I'm going to pull the sacrum away from L5. Now I'm going to ask him for an extension effort, which is going to tighten up the lumbar extensors. Push into me with your knees. Good. So he's trying to extend his lumbar through his legs. Relax. Stretch and pull the sacrum away from 5. Nice stretch at the bottom of the spine. I'm taking the sacrum away caudally, in flexion, so I'm stretching the lumbar extensors in the lower lumbar area. Get on the sacrum, go to the slack, push down, extension effort with your knees, good, and relax, good. Extract the sacrum from 5 and stretch, good. Again, isometric effort, push into my hand, and arm around it, relax, and pull and stretch. As I stretch him, I turn him into more flexion. So this is a good stretch for someone who's hyperlordotic, who has flexion dysfunction, but not someone who has a posterior derangement. All right? Yeah. Now, just to make sure I didn't hurt someone, because you may have, they may not even be aware of it, but they have a little weakness back there. And we'll get into this next week. Turn over. We call this prophylactic extension. Just to make sure you put everything back before they get up. If they get off the table and say, oh, can't straighten up. You don't want that to happen. Now you're with them a little while before they can leave. So, little extension, hands here. Now gently come up. Good. Pump it. Gently. Don't force it. A little bit more. Good. Restore the lordosis. Because you're dealing with a lot of fluid back here. 85, 90% water, so when you do all that flexion, you could push the nucleus posteriorly. You want to push it a little bit back. Hypothetically, we really don't know that we're doing that. It certainly behaves like that's the case. Come up, so just gentle on, off, good, until you get those elbows straight. Call it prophylactic extension, just to make sure that they don't have a problem with a posterior derangement because of what we did. All right? Is that it on the connective tissue? Thoracolumbar, iliopsoas. We did this in massage last year. It's that way. Now, on your stomach, let's just show you one more time how to find the psoas on your back. We went through this last time. You're going to come on the lateral edge of the rectus abdominis. Flex the rectus on that side. Shorten the psoas so you can get in. And you're going at an oblique angle towards the spine. And in some people, you really can, you got to cut your nails. You can really get right in there. You can even, in some people with a soft abdomen, you can even feel the vertebral bodies. So you're trying to get into the point where you feel a cord. It feels like a rope. That's the psoas. You don't want to be on rectus abdominis. You want to be deep to that. Sometimes you got to really shorten it up even more until you feel that you're on the psoas. You can do your strumming here to start. Once you found it, turn on your side. Then I shorten it up, and people do counter strain here as well. If you find they're really tender, just monitor a point. It's called release through positioning. Find a Jones point or a tender point. We discussed this last year. And I'll ask him, tender. On a scale of 0 to 10, how tender is that? Let's say 7. Okay. I'm not going to change my pressure. By just adjusting the position of his hip, I flex. What would I do next for psoas? Externally or internally rotate to shorten it? I would externally rotate to shorten it. And I say, okay, now, what's that number? He says 5, but you lessen your pressure. No, I didn't. It's called release through positioning. You shorten the muscle, it becomes softer, more comfortable. You keep trying to find that exact combination of positions, a little adduction, abduction, whatever it takes to turn that point off. That's counter strain. And once you found it, you've turned it off, you hold it for 90 seconds to allow it to accept that change, and you gently lengthen back to neutral. That's strain, counter strain. You can take courses in that. Or you can just come in here and shorten it, do your strumming on psoas. Let's get the bottom leg flexed so that we have some support. And now we bring them into the stretch part of the range. I give some force with my abdomen against the pelvis, something to push against. And now I strum the lengthen. So I start short, turn it off, and I go to long. And I strum. Specific compression, whatever you want to do, just to free that up. Psoas is a big troublemaker. You can treat FRSs in the lumbar spine just by treating psoas. It wreaks a lot of havoc on the segments of the lumbar spine. So that's a way to turn that system off. All right? Yeah. All right? So let's just go through the